Hello there, my wellness friends. This is AJ Webb, your SLV Health Wellness Coordinator. And if you've ever had to use your paid time off to take a sick day, you know it's a bummer. Well, what if I could tell you that if you spend a couple extra minutes a day to really lock down your hand hygiene, you might be able to save some of that PTO, spare yourself, spare your friends, spare your family, and possibly even spare your coworkers and our patients here at SLV Health the trouble of going through and being sick, spreading bacteria and viruses just because you may not have your hand washing game on point. I am not a clinical mind. I come from a background in business administration and other things like that. So I wanted to see if I am properly addressing and have the appropriate level of respect, dare I say fear, of stuff that can get passed along with your hands. So in order to do that, I sat down with Jessica Watt. Jessica Watt is an infection prevention practitioner. She also calls herself an infection control nurse, and she works here at SLV Health. She has 9 years of experience in the healthcare field, holding a variety of different roles in the ICU, in the emergency department, and nursing home as a school nurse. And Jessica has been tasked with implementing a hand hygiene monitoring system. And I was fascinated to learn how this department plans on tracking these things and making it so that we are continually practicing quality hand hygiene. And I wanted to learn what are clinical folks doing that a non-clinical folk like myself might not be doing, so I can better protect myself against germs and bacteria and viruses and these things, so I don't have to waste that precious PTO time that I'd rather use for fishing and doing fun stuff with my family. So, in this interview, I sit down with her, I learn about the hand hygiene system, I learn about the proper techniques in order to make sure your hands are spick and span and extra clean and lotiony so they don't crack, and I know you will enjoy this episode with Jessica Watt. Enjoy. Please subscribe to this YouTube channel, like these videos, share them with your friends, and leave some comments. And if you're interested in keeping up with the other things we're doing at San Luis Valley Health in our wellness program, whether it's for you or whether it's for your corporate wellness program, you can visit us at www.slvhwellness.blogspot.com. See you there. Disclaimer. Do not use this information as medical advice. Instead, see your own family doctor for care. The opinions expressed do not represent the opinions of SLV Health. How long have you worked here for SLV Health?
3 years in July.
3 years. In what departments?
I worked in ICU before I took over this role.
Very nice. Can you tell me, so when we're talking about infectious diseases, what exactly it is that we are talking about? Like, what are the names of the cooties out there, and what do they do to us?
Well, it just depends on what kind of cooties you're talking about. So, I mean, one big one that everybody's pretty familiar with would be like the flu. Mm-hmm. So that's just a viral infection. Anytime you cough on yourself, or if you have the flu or whatever, all of those germs are being spread all over the place. But basically, you can just think of it in the sense that anything that gets you sick can be considered a cootie.
Right. So viruses or bacteria? Okay. And I understand that there's like different stuff out there, like that there's like, I was explaining to me like, hey, soap and water, that's going to help out bacteria-wise. The hand sanitizer, that's going to help out viral-wise. Is that accurate? I mean, or is it?
Well, it's a little bit more complicated than
okay.
that. But
good. I figured it was.
Yeah.
And that's why I'm asking. So.
But one thing, so hand sanitizer should actually kill the germs that are on your hands, while soap and water and using good friction breaks them loose from your skin and washes them down the sink.
Okay. Okay. So that friction is important.
Yes.
Okay. So I think it's like a silly, I mean, I'm asking anyway, so the consequences, right, of not paying attention to these and not practicing good hand hygiene. What are we risking by either not paying attention to this or not developing and like taking some time to really develop some good habits around this? What are we risking?
you're essentially risking getting sick, because anytime you touch anything, you pick up, microbial particles from whatever, and then you're going to transfer it to anything else you touch. So like if there's something gross on the table and touch it, and then go and pick up your sandwich and start eating, then you just transferred all of those gross germs from the table to your hands, to your sandwich, and into your mouth, and then who knows what happens from there, just depending on what kind of germs it is.
How about these things?
Oh, those are probably
This has got to be like the grossest thing around here.
Yeah.
I'm feeling uncomfortable holding it now.
You should probably clean it.
I should probably clean it. Okay, so we may go wash our hands, but we may end up contaminating it by touching stuff that we may not be cleaning on a regular basis. This is accurate?
Yeah, and I mean, some things can live on surfaces for months, just depending on, how well it's cleaned or what it's cleaned with or whatever.
Gotcha. So we can kind of break this up into like what's best for non-clinical type positions and jobs and versus clinical. But before we do that, for clinical folks, this really is like, it's not an option. Hand hygiene, like there's even programs that's like, it's part of the law. So tell us about what are the requirements for us to be a healthcare facility in regards to hand hygiene for clinical folks?
So it's a requirement from CMS that we have some kind of hand hygiene monitoring.
Pardon my ignorance, what is CMS?
So CMS is basically like the law of healthcare.
Okay.
So they're the ones that come in and set the rules and say what standards we have to meet and those types of things. So according to them, we have to have some kind of hand hygiene program in place.
Okay.
What we've been doing for the past several years is direct observation. So everybody that works in the clinical area is probably familiar with the iPads, the little app that's on there. You have to say, oh, I saw a doctor go into that room. He washed his hands when he went in, but not when he came out. And then all of that data is sent over to me, and I have to kind of get a compliance rate from there. And then the clinics just use a spreadsheet, which is essentially the same thing. But the problem with that is nobody wants to say, AJ didn't wash his hands.
Nobody wants to narc on anybody.
Yeah, exactly. They want to put in there when you do well. Right. So it makes our compliance rates seem a lot higher than what they are, because we've used a few students to do secret shopping, so to speak.
Yeah.
And our numbers are always way lower with that.
Gotcha.
But at the end of the day, we have to meet the requirements of CMS, but we just want people to be safe, like our patients, our staff, our families, everybody.
So CMS is the folks that they're going to set the standard, and we have to meet that standard. What is the best practice for a nurse, for a direct care person? I mean, is it every time I leave a room? What does that look like?
So basically, anytime you go in a room, when you're leaving a room, if you're doing some kind of procedure and your hands get soiled, if you have bare skin contact with some kind of bodily fluids, those types of things. And I always tell people too, if you're in doubt, like if you feel like, maybe I should wash my hands, you should probably just wash your hands, because it's better to do it too much than not enough. But there's soap in each room, there's hand sanitizer in each room, so you can use either one.
So anytime I'm contacting a new place or a new person, or some stuff gets on me, it's a good idea for me to go and wash my hands.
Right. Or anytime after you use the bathroom, before eating. Those types of things. Okay,
so the normal people stuff, after potty, before you eat, after you touch some garbage or something like that. So regular people stuff that I understood already. But then, just to understand my fellow coworkers, my clinical-based coworkers, they're having to do this from room to room, from patient to patient, every time something gets gooey on them.
Yeah.
All right.
Pretty much.
So this has been my experience when it comes to tracking stuff like that, right? Is that our minds get kind of slippery, right? And when I have to manually track stuff, it's easiest if it's done automatically by a machine, or if it's a simple yes/no question and I can like be committed to being honest about it, right? That's kind of how the stuff works in Virgin Pulse. Like, did I stick to my meal plan? Yes or no? No, I had an icy at the circus with my daughter, right? So that's a clear question. I could fudge it. I was just half, but it gets
honest
slippery.
With ourselves.
Right, because while no one's at humongous risk for that, It's different when we're talking about bacteria and infection and a patient whose immune system is weakened because they're already fighting something else off.
Right.
It's easier when it's done automatically. So tell us about this new system that we're implementing. So is this the implementation phase? Is that what you describe it as?
Yeah, that's
All right.
a good way of putting it.
And it tracks these things automatically between the soap dispenser and a device on the badge?
Yes.
Tell us about this system, and what do you want people to know about it?
So basically, in the patient care areas, all of the soap dispensers and the hand sanitizer dispensers have little tracking things in them, I guess you could say. And then each one of the beds have a little beacon on them. So the beacon makes like a bubble around the bed, and they call that the patient zone. So anytime you enter into the patient zone, you're expected to wash your hands before that, and then when you leave the patient zone, you're expected to wash your hands again. So that can be soap or hand sanitizer.
Okay.
It doesn't matter which one you use. We have monitoring in the rooms and in the halls. So if you go and use the soap dispenser in the med room, say, and then you go straight into a patient room after that, then you're going to be marked as compliant. Or if you do it inside of the room, then that will still count too. Just as long as you have washed your hands before you go into that patient zone, then you're counted as doing hand hygiene.
There you go.
And then these badges are kind of cool. They have these little lights on them.
Okay.
So we're not in a patient care area right now, so
Right.
one isn't lighting up. But after you've washed your hands, then it'll be blinking green, saying that you're safe to interact with the patient, you've washed your hands, whatever.
Okay.
If you go into the zone and you haven't washed your hands, and this one in the middle will turn yellow, and it'll beep at you kind of to remind you. And then if a certain amount of time has elapsed and you still haven't washed your hands, then it'll start marking red, and then you'll be counted as non-compliant.
I gotcha. That's that in my apps. So I don't have to wear this. I've not experienced this. Like
Right.
maybe I've been doing this for 20 years, and I don't need something beeping at me to remind me, right?
Yes.
Maybe I have some good habits, and I'm solid on them. But at the same time, again, like I've never rinsed my keyboard, right? This is kind of like this scary new thing for me, right?
Yeah.
To where I may need to develop these habits. So I guess I could see how, someone that's, done this for a long time, they're legit. But at the same time, if you're washing your hands, it seems pretty foolproof.
Yeah. All you got to do is wear the badge. Okay. So this makes the iPads going away or go away. We don't have to worry about that anymore. If you are washing your hands, awesome. If you're not washing your hands, then it's to be used as a reminder. Like,
right.
We don't want to be hounding people. We're not trying to keep tabs on everybody. It's just
it's
to
a cue.
help us out.
I call those things cue, and I use those in like personal training. Like for me, I leave my desk. Like it might be a little messy, but I'm gonna put my planner and I'm gonna put my big cup of water so that I know when I get to work, I need to go fill that sucker up because I need to drink one before lunch, and then I need to figure out what my list is. And that's just like a cue to me. And I don't get mad. Get out of here. I know what I'm supposed to do, planner.
Yeah.
But sometimes I feel that way.
Right.
Or I just want to. I'm gonna hide this. That's I like the idea of the automation of it. Right. That we don't have to rely on. I mean, it keeps it from being people dependent in regards to tracking the data. Now you get so it compiles the data on all the green lights and the yellow lights and the red lights. Is that a good way to say that? Yeah. And it lets us know. Like it gives us some things that we can measure without the human element skewing it, without, would you say it's a higher quality source of data?
It is. It's much more accurate. And it gives us an idea of where people are lacking in their hand hygiene. So It's not to come down on you and say, you're going to be in a lot of trouble.
Yeah, this isn't a moral issue.
You're not washing your hands after you touch patients or whatever. It's like letting us know where we need to focus our efforts as far as education goes and getting better, because all of us can get better.
Right.
Like no matter what the issue is or whatever, we can all get better. So this is just trying to help us figure out where we can improve.
This is not the first place in the universe to use such a system, is it?
No.
Where else have these been used? I mean, are there other big healthcare organizations or?
So the company that we went through, they actually only have a few hospitals in Florida. So we're one of the first ones with that company that has moved out west, so to speak. But there are some hospitals up north that have similar systems. They're just from different companies. The lady that I know at CHA said Denver Health has something similar to this, and I think there's a few other ones up north. So I think it'll be more common moving forward. It's just kind of a new technology, and we're lucky to have it.
Right. That's how I feel about our wellness program and our wellness platform. Is we get a nice, intuitive tool that, you know, it links up my Fitbit steps, and it really kind of takes that out of it, so I can earn my wellness points and I can take care of myself without having to make a whole bunch of extra decisions and do a whole bunch of extra steps. I mean, taking clicks out of stuff is a good thing, generally speaking. Sounds like this takes clicks out, helps us, and ultimately helps our patients and helps us stay healthy, which is the part that I'm really interested in. It's like, we got to, you know, follow our beep beep protocol here. We're also going to be healthier ourselves, because while I've not had a high stress clinical type position, I do know what it's like to have a teammate out. And you got to cover for them, right? And then maybe they bring back their cooties, and you're stressed from, you know, having to take over their job. I mean, it's a big deal when we don't have all the pieces, and if we can keep all the pieces moving and working together and healthy, that's a good thing, right?
Well, and then none of us want to go home and get our families sick either.
Right.
We all hate having sick kids or being sick and having to still take care of our kids or whatever. So
it can be. I remember, you know, the early stages of my, you know, career. You know, as a dad, it's like, man, you know, taking that day off and having to miss those hours. That was a big deal for my household income.
Yeah, absolutely.
And you know, some people are like, well, it's just a sick day. Well, you've run out of sick days. I mean, there's just a lot of stuff going on there. And being sick is a bummer. And if we can do a few things, clinical and non-clinical, like clinical follows the rules that they're supposed to follow, gets tracked automatically, high five. But then non-clinical folks like myself can learn and maybe adopt some of those good practices, because you're right. Like, you go into billing, you go into coding, there's a lot more people. I mean, I don't know what other places look like, so I would say, generally speaking, there's a lot more people in there. You're sharing instruments and spaces and stuff like that. And oh, by the way, you're walking through hallways where there are other people that may be coming in because they have a cold, an infection, or something like that. So so non-clinical AJ, who doesn't wipe down his keyboard, what are some of the things that I should think about in order to keep myself healthy, keep my family healthy, in regards to my own personal office space?
So have you ever taken any microbiology classes?
Nope.
Okay, so
they don't let us in there.
If you just think of it this way, you know, we all know generally bacteria, viruses, fungus, whatever, they're all tiny little organisms that we can't see with our naked eye, but if you look under a microscope or whatever, then you can. So just think of all the things you've touched and all the things you've picked up with your hands, and then you touch your keyboard. All of those little things are now growing on your keyboard. And then the more stuff that you touch and add to that, the more bacteria and viruses and whatever grow on there, and then it's just everywhere. Like,
just a petri dish.
Yeah, pretty much. It's pretty interesting to kind of like swab doorknobs or tables or whatever and see what you can grow from that. It'll make you...
Mice.
Cell phones especially.
These kind of mice.
Yes, exactly. But cell phones especially, because I mean, you take that everywhere with you. Everywhere.
Right.
And so then it picks up a bunch of nasty stuff, and then you put it on your face.
So yeah. Ugh. You said interesting. I think you meant terrifying.
Yeah. Well, and then even your beard. I mean, they found a lot of stuff growing in.
I'm sure. I was going to close with like a punchline joke about like how risky is this. So I guess I'll have to shave my beard now. So these things that I'm touching on a regular basis: keyboards, mice, my own doorknob to my own office. Do I need to wipe these down? Like before I don't know if you're just showing off, but you're wiping down this desk that just had like flower material from like Mother's Day flowers on it, right? So that was nice, but at the same time, like I feel pretty confident in the cleanliness of this table. What did you use? And do you have like a special wax on technique, or are you just trying to get the liquid that's on that onto the surface?
So I use the Cavi wipes that are provided from the hospital.
Okay.
They should be available regardless of where you work. So if
Okay.
you're in a clinical area, non-clinical area, if you need them, you know, you can tell your supervisor, hey, I need some cavi wipes to clean my area, and they should be able to give them to you.
Okay.
Essentially, my method is just to make sure I hit all of the surfaces of the table, but there is a contact time of 3 minutes. So for them to be able to guarantee that it's going to be clean, or you know, that you get the most out of it, it should be wet for at least 3 minutes to kill anything that's on the surface.
And then I'm on my own little island in my office, so maybe this is happening all the time, but now I know what to look for in regards to cleaning up my own stuff, and I'm sure everyone else is doing it. I'm probably the only one.
Oh, you're probably not the only one. I don't think a lot of people think of it, and then especially like you said, people who are not of clinical mindset and who haven't taken microbiology classes and whatever, you just don't know, or you don't think of it that way. Like, microbiology ruined my life. I see stuff crawling everywhere, so it just kind of freaks me out. I like to have clean things.
Yeah. So, things I touch. Find some of these cavi wipes. If I didn't, let's imagine I walk into like a group of people and I don't see a bucket of cavi wipes. Who should I talk to about that?
Whoever does supplies for your area, or even your supervisor. I think all of the supervisors of the different areas are pretty on board with keeping things clean and protecting all of our staff and our patients and stuff. So
so let's imagine I'm practicing normal human hand hygiene, washing my hands when, you know, before I eat, after I make potty. And now I'm saying, okay, I'm going to wipe down the stuff that I touch on a regular basis. What else can I could live in a bubble, right? But what else is it, generally speaking, a good practice in regard, like I walk through the break room, I walk through the waiting room, like what else should I be doing to help protect myself?
Well, you know, if you are sick, you want to cover your cough. You don't want to cough into your hands. You want to cough into your elbow.
The elbow?
Yeah, so that way you're not touching everything. Yeah, dab it. That's the cool new thing. You know, if you have to blow your nose, wash your hands after you throw the tissue away. Of course, after using the bathroom, wash your hands. But then one thing that a lot of people don't think about, you know, there's a lot of people who don't wash their hands after using the bathroom. So then when you open the door, you should really use a clean
I've seen the paper towel trick. Like you dry your hands with a paper towel, and then you paper towel on the doorknob, and then you shoot the J.
Yeah, exactly.
Okay.
And even to turn off the faucet too, you should use a paper towel.
Oh.
So
that's smart.
You make your potty or whatever. Wash your hands. When you dry your hands, use paper towel to turn off the faucet, and then use paper towel to open the door, turn off the light, make the J at the end.
Got it. Gotta hit the jumper. My children, right? So it's part of their routine when I take them to daycare now. Like the first thing we do, we get there, I sign them in. My daughter, I send her to go wash her hands because that's what the school does. And then my son, then I take him to go and wash his hands, right? Sometimes though, like they've gone through some different soaps. My poor kid, he just had really, really red hands. He had a little cracking and things like that. What should we do to take care of our hands that's still going to preserve the sanitation, but also keep our hands silky soft?
So one thing that you can do is you don't have to use super hot water to wash your hands. Just use lukewarm water, an appropriate amount of soap, wash it off, dry them, and then put lotion on. Working in frontline patient care for as long as I never wash my hands without putting lotion on after. Mm-hmm. Even when I'm super busy, there might be some times when I do, but you got to take care of your hands, and we all know we got to keep them clean. Mm-hmm. That's one of the things you can do. Another thing, when you use hand sanitizer, it builds up after a while and it can be kind of drying to your skin. So after you've applied it a few times, then it's good to wash it off with soap and water and then again put lotion on. That's one of the best things you can do. Any lotion specific? What kind of lotion do you use? I think there's lotion that's kind of provided around here. Yeah, we have lotion that's provided, and that stuff is really awesome. It's very healing.
Very nice. So I'm rinsing things, or I'm wiping stuff off with these cavi wipes, letting it set for 3 minutes. I'm disinfecting my phone. my keyboard, when I'm leaving room, coughing, stuff like that. I'm doing the normal human hand sanitation, hand hygiene, but also taking care of those different areas. Anything else that I had to know about hand hygiene as a non-clinical minded person?
Some things that I always think about, like especially for admission staff and stuff like that, and it may.
I see them cleaning their. I mean, they go through the thing. I was like, oh, that's nice. They're dusting, but that's not what's going on. I've seen them at the PS clinic. They're doing a good job. I'm sure they do it in other places too. But way to go, PS clinic front staff. I seen you.
But like, what about the pens that they share with patients and stuff?
Okay.
You know, because you don't know where the patient's hands have been before they came into the office. So then they go and touch your hand or your pen, and then you're touching the pen, and then you're touching everything else. So I think it's good to clean down not only your keyboard and your mice and your phone, but other things that are frequently touched that people might not think about, like pens, clipboards, those types of things. Because I mean, even though you might not be a clinical staff member, you're sharing your pen and your clipboard and everything with all of the sick people coming in. So you can clean those things. That's good. Or if you're sick, you know, you can wear a mask. Or if you notice that somebody's coming in and they have a really bad cough or whatever, it's okay to ask the patients to wear a mask too. Because even if you think about it, you know, if they're at your desk and they're coughing a bunch, well, they're going up to the waiting room next, and then they're going to be exposing everybody else in the waiting room to that same thing. So it's okay to ask them to cover their cough.
Gotcha. And for those folks with beard, this has made me think about it, because I do like this mustache twirl for a while, and I'm not really paying attention. I'm like, oh, I got to twirl my mustache. Time to go wash my hands. I haven't been thinking about it that way. So maybe it's time for the facial hair to go. Anything else that you want us to know about the hand hygiene system? I mean, because there are some things to dispel about it. I mean, I understand, you know, it felt like Big Brother in some regards, right?
Yeah.
Are we trying to nail people here? Find those sinners who are not washing their hands? Is that the idea here?
No, that's not the idea at all.
What's the gist here?
So the general idea is just that we figure out where we're lacking, how we can improve, and that we're compliant with the regulations. And right now in these beginning phases, really what we want is just for people to wear their badges, to see how they're working, try to work out the kinks. So if there's something that people see is wrong with the system, or a dispenser that's not monitored that maybe it should be, you know, just let me know. There should be communication logs at all of the nurses' stations, stuff like that. But I can't fix the problem if I don't know that there is one. So I just, you know, ask that people help me out and give it a chance. I mean, I think it takes a while for an adjustment period for anything, like any new thing. You got to give yourself time to adjust, you know.
Right.
It's not Big Brother though. I mean, there's you know, 750 employees of the organization. There's only one of me. Even if I wanted to, there's no way I could go through everybody's data every single day. And I'm not trying to keep tabs on anyone. Like, none of the leadership is, because I'm not the only one that's looking at this stuff. But we just want to get better, and we want to do what's best for ourselves, for our patients, for our families, and that's just to keep infection isolated as much as possible.
Roger that. Jessica, thank you for educating a non-clinical mind about some of the finer points in this, and helping me understand what's going on with these new systems. I hope that this could be an absolutely absurd, like I could see like someone who's been a nurse for 20 years going like, why is AJ talking to someone about washing hands? That stuff's second nature and stuff like that. But I think it was definitely helpful for me to know and understand more about the system. And thank you so much for spending this time with me.
Yeah, thank you so much.
Let's do elbows so that way we don't. Usually I do high fives, but we'll do the elbows. Thank you, Jessica.
Thanks.